In my opinion, you want to grab as much protection as you can in this pandemic, and so I would encourage people who have had natural infection, who have not been vaccinated, to certainly get vaccinated to boost that immunity even higher so that they're lowering their risk of reinfection. Clearly, the people that are dying from COVID are people that are going to be at higher risk. And so the question is, who's at high risk? Age clearly plays a factor. So those that are older are going to be at higher risk. Those that have a variety of medical conditions. We know that some of the big conditions that have shown up in hospitalized patients that put them at substantial risk of critical disease or death are diabetes. Obesity seems to be a really big risk factor. But even other conditions, chronic heart disease, chronic lung disease, chronic renal disease, and certainly people that don't have normal immune systems at baseline, whether that's for certain disease states or medications that they get for certain conditions. Those that are immunosuppressed are going to be higher risk. So those are the individuals we see get into trouble. I could say that certainly it's harder to argue with the younger, healthier group. However, I think that group, this is sort of when you need to look beyond yourself and see that you're trying to protect others within our society. And I always tell people, just need to look within your close, surrounding individuals, your family, your close friends, right? Those are the people you're putting at risk. If you're in that lower risk category and you decide that you don't want to get vaccinated, for example, that you potentially are putting those individuals that may be higher risk around you at greater risk. So if you're looking at an individual standpoint only, it's kind of easy to sit there and say, you know what, I'm young, I'm healthy, I don't need to do anything. But you've got to look at really who's immediately around you as well and try to protect them as well.
Because it will cause severe illness in some people, especially those that aren't vaccinated, we're not quite comfortable giving that recommendation yet. It's a lot more infectious, so a lot more people are going to catch it using the masking and other techniques that we're using right now, because it's able to bypass some of that and cause infection more easily. The trouble also with everybody catching it all at once is we're seeing staffing issues already because so many people are catching it. Even if they aren't very sick, they're often called off for at least a few days. That makes the hospital have fewer staff. We're seeing more people coming into the emergency room right now because private offices don't want to see people who may possibly have COVID, and they're sending them to the emergency room. So right now is a very bad time to spend hours waiting in the emergency room.
People with natural COVID tend to get more infections after natural COVID than folks with the vaccine.
That's one of the more common questions that I get, and it's a very good question. I think the problem is when you look at each individual is unique, and you don't quite know how they're going to behave beyond that. We know from bigger population studies that if you take a group of people, some of the individuals in that group, even if they've been naturally infected, are going to be at risk for reinfection. And we've certainly seen reinfection. It is not, I would say, common. However, we're not that deep into the pandemic. And I think the Omicron surge is starting to sort of show that those individuals who only have natural immunity in the background are certainly at risk for getting reinfected. But there may be some individuals where that is enough. But I think, in my opinion, you want to grab as much protection as you can in this pandemic, and so I would encourage people who have had natural infection, who have not been vaccinated, to certainly get vaccinated to boost that immunity even higher so that they're lowering their risk of reinfection.
So after you've had COVID, yes, that's a fantastic thing that you get something called natural immunity. That seems to last most reliably for about 90 days after your first illness. After about the 90-day mark, if you get symptoms again, we are recommending COVID testing. It's possible to get COVID a second time. In general, the best way probably to be protected is natural immunity plus a vaccine. You can certainly get your vaccine after you've had COVID, once your symptoms are resolved. And I do recommend that because we don't know what the future may hold in terms of future variants, and it's certainly possible to get COVID twice.
What happens if you have natural COVID and then you get a vaccination? And that's a unique issue where antibody levels actually go very, very high, and protection seems to be very good. And it's given a term called hybrid immunity or super immunity. Those are folks who probably have the best overall immunity. If I had a choice as to, knowing that I'm going to get both a vaccine and I'm going to get natural COVID, I would get the vaccine first because it's safer than natural COVID. You're not going to go to the hospital because of your vaccine. And then if you get COVID, your levels of antibodies and that protection are going to go super high into that hybrid immunity, that super immunity type of situation. Getting a natural COVID infection is the most dangerous thing because that's where the group of people originate that are hospitalized, that do die.
One article in The Lancet also showed that if you got COVID and were unvaccinated versus getting COVID and you're vaccinated, if you were unvaccinated, you have a greater chance of having long-term health problems. For example, lung problems or brain fog or kidney problems or heart problems. So being vaccinated lowers your risk of long-term side effects.
That's not true at all. So any experience of an illness is not so much in your body the presence of that virus or that bacteria or that parasite. Is your immune system's ability to recognize that virus or that parasite. It's the fight that your immune system does that actually gives you those symptoms. So yes, the vaccine, I can't tell you it's without side effects. It certainly causes a little bit of a COVID-like experience, but having those symptoms for a few days in a controlled manner is much preferable to the COVID experience, the actual illness, especially to the degree I'm seeing in the hospital setting. Certainly not everybody has a severe case of COVID, but what I'm seeing in the hospital setting is weeks to months of just a really atrocious experience, being attached to the wall via the oxygen tube, barely being able to breathe enough to eat, not being able to breathe enough to get to the bathroom. When we recommend any sort of vaccination, or really anything in life, doctors do so with a recognition that there's risks and there's benefits to everything that we do. And we take that Hippocratic oath to try to recommend the most benefit without causing harm. And so the vaccine, yes, it has a few side effects, but compared to what that COVID experience can be like for some people, yeah, I'd get it in a heartbeat.
So some people ask me, does the vaccine alter my DNA? The short answer to that is no, definitely not. The long answer is that the vaccine gets incorporated into the cell, but not into the nucleus of the cell where DNA is stored. So it's not possible for the vaccine to alter your DNA. There's many different types of genetic materials, but it can mainly be divided into two parts, DNA and RNA. DNA is like your blueprint for making your body. RNA is a copy of that blueprint that helps make the proteins for your body. So they're very different type of genetic material with different purposes and different locations in the cell. So the way that mRNA technology works is that you're giving genetic information about what the coronavirus looks like and instructing the cells to make wanted posters for your immune system to seek out that target for when you eventually encounter coronavirus. It knows exactly what it's looking for.
One of the exciting things that's coming out of this is that there's a lot of research going on into how to make what's called an RNA immunization, the RNA vaccine. And that's just a technology that's being worked on for the last several years to be able to package an immunization within a few months. We used to have to grow it in egg cultures for months and months and months and months, and it would take us 2 to 3 years to get an immunization out. When really this one was designed and put up and proposed within just probably a month or two because of technology now. It went through the trials like the other ones that were grown for 2 years, but the ability to come up with an RNA immunization it's a signal to your body as to what to be prepared for. It's a little messenger that our bodies have anyway. And so it's in many ways, a very natural thing for your body to see an RNA piece and make an antibody to be prepared for what's coming. But we could make if we saw a bad variant in July of this year, we could come out within 2 to 3 months with an immunization for that, which would be very exciting to be able to do that. And a lot of what we know about the way cells work and our technology for this right now came because of research for HIV. Before that, we just talked about organs and cell systems and things, but when HIV came, we had to find out how do cells work, how do they talk to each other, and how do they work inside. And that has given us so much for everything else.
I say no. Just being healthy in general is very important for not being hospitalized. So what do I mean by that? If you're overweight, if you have diabetes, if you have lung disease, if you smoke, if you have chronic liver disease and you drink, all these things add to your chance of being hospitalized if you get COVID. So what do you do in terms of having a healthy lifestyle? You want to control your weight. You want to keep your diabetes under control. I give a handout to my patients about having a plant-based Mediterranean diet. These are all things that lend towards weight control, being healthy in general. Not only are you healthy about fighting COVID, you'll be healthy about handling many types of diseases, whether it's cancer, whether it's diabetes, whether it's you getting the flu or the cold or other diseases. If you're healthy in general, then you're going to be reducing your chance of hospitalization in general and with COVID.
That's a great question, and a lot of people have asked that. Because we're used to thinking in terms of, I get my measles shot so I don't get measles. To understand this one, you have to know why you get immunizations for 2 reasons. You get immunizations to protect you, and you get an immunization to protect other people around me. That's why I get immunized. So I would like to protect myself, but I would also like to help protect my community. And the more people that get immunized, the better we protect the community as well. In the case of this immunization, clearly we've noticed that people can still get COVID, but statistically they're not as sick and they're not as sick as long. So they have milder cases. So that's doing a few things. It's relieving the hospital burden. 95% of the people dying in the hospital right now are unimmunized. That means that 5% got their shots. But 95% of what's occupying the hospital and the healthcare resources are unimmunized patients. So really when we get immunized, it helps us get through this, it helps us get past it, it helps us not overrun the hospital resource. And that's a really big key, is to not overrun our hospital resources.
It's actually not dangerous for the baby. Yes, we do feel strongly that women should get vaccinated. There's been several large studies now that have demonstrated that the risk of getting COVID while you're pregnant is significant. Pregnancy itself is considered a risk factor for severe COVID disease. The vaccines are protective against that. The vast majority of women that are pregnant that have to get hospitalized at the hospital for COVID are unvaccinated patients. There was a lot of misinformation that came out early in the process when the vaccines were released that created fear, misunderstanding of the potential impact of the vaccines on pregnancy. And those fears generated circulated on social media weren't based in reality or data and haven't proven to be true.
So some people asked me what are the ingredients of the vaccine and what are some long-term side effects from that. Fortunately, the mRNA vaccines are made with as little ingredients as possible. That's why it needs to be frozen at minus 100 degrees Fahrenheit. Otherwise, it degrades very rapidly. Imagine how long it stays in your body. Not very long at all.
There's really no association between using tromethamine, and it's also called THAM, T-H-A-M, as a buffer for heart attacks. People that have heart failure, that have heart surgery on a cardiac bypass machine, sometimes develop acidosis in their blood. And THAM is one of the drugs that's used in huge amounts to make their blood balanced, to make the pH in the blood balanced. So it's really not a heart attack medicine of any sort, and it's not put, and it's put only in the vaccine to balance out the acid base. It's used in other vaccines too. The Moderna vaccine also has the trimethamine in it. So the relation between heart attacks is not exactly accurate, because people with certain cardiac conditions and other medical conditions, and children too, that have severe acidosis unrelated to COVID, unrelated to a vaccine, are given very large amounts of this to balance the pH, the acid-base balance of their blood.
If you get COVID, your life is derailed for an unknown period of weeks to months. If unfortunately you get severe COVID and end up in the hospital setting. Conversely, you can plan around your vaccination timeframes, especially if you had one vaccine and you can predict a little bit of how your body reacts to it. You can reach out to your doctor and find out how to best mitigate those side effects, how to take some Tylenol on a certain time frame to make those side effects impact your life that day a little bit less, or plan your days off, decide, oh, I'm working this day and I'll get my vaccine on this day that I have off. So certainly I think that if you recognize, yes, this vaccine may make me feel under the weather for 24 hours and it's better than getting actual COVID, then certainly you can reach out to your doctor and you can plan the very best way to mitigate those side effects.
I really tell them that the vaccines are very safe. They do have side effects. Everything we prescribe has some side effects. But I think the vaccines have been now administered billions of times around the world and millions of times in the US. And really the safety is very well known. Again, there's side effects. We report them, we compile them, and they're investigated. But when people are worried about vaccines, I say we've really done the biggest trial of a vaccine ever in this outbreak, and we have not seen thousands of people dying, certainly not concentrated after getting vaccinated. So vaccination is still the best way to protect yourself.
So I have a lot of parents that are concerned about their children and getting a new vaccine. They already get so many vaccines in childhood that they wonder, do we need one more? And the answer to that is yes, they do, because it's a new disease, right? We haven't seen a coronavirus like this before. And it does impact our children's lives, their ability to go to school safely, to keep them out of the hospital and getting really sick. So I encourage anyone to vaccinate their children if they're eligible for it.
We know that the antibodies fall off fairly quickly, both from the vaccine and also from the natural infection. And so a booster, even if you've had prior COVID, will provide added protection. The big problem is we don't know how long the booster is going to last. So this is still a work in progress. It looks like it's very safe. The two vaccines from Pfizer and Moderna are very similar, and they can pretty much be interchanged. They've done studies showing that the antibody levels go up whether you use one or the other. The Johnson & Johnson vaccine, which is gradually falling out of favor, is still going to have some use. Somebody who's had, say, a reaction to one of the mRNA vaccines might want to complete the series by taking Johnson & Johnson, but its role is shrinking.
The effectiveness of the vaccine and booster shots seems to be less in people that are immunocompromised, and those are a lot of the patients that I actually take care of. And there is discussion about having a fourth shot, a second booster, and that has become available for folks with the immunocompromised state. I would go get it if I had, if I was immunocompromised.
The first time through, they wanted to make sure any side effects that you had were clearly from the vaccine, not from, say, a flu shot that you got at the same time. Now that they've studied the side effects and know them pretty well and realize that they're different than the ones you get with a flu shot, you can certainly mix them. And they're actually saying you could even have, say, a third vaccine. Say if you needed a pneumonia vaccine at the same time, you could take that. You do kind of run out of sites to poke because they like to give them in separate ones. So after they do your shoulders, the next site is usually in your thigh. And a lot of people will kind of pass on that.
This is a picture of the COVID virus. And the virus itself has these viral particles inside the capsule. So this is the area. Outside are these spike proteins. And the vaccine is the spike protein, the non-infectious spike protein part of the capsule. So when you get the vaccine, you get the spike protein and your body thinks that it's getting the virus, but it's just getting the spike protein, and your body then will develop antibodies. So what would you rather have? Just a little spike protein where your body develops antibodies? Or would you rather have the full virus with the virus inside the capsule that delivers to you a 14 times greater chance of being hospitalized, a 30 times greater chance of dying, and a much greater chance of having long-term side effects, heart disease, lung disease, brain fog, loss of taste. So the vaccine is part of the virus, but a very small spike protein, and it's non-infectious. But yet it helps your body create antibodies against the virus.
You know, one of the things that we've been observing in the hospital setting, so not everybody gets severe COVID, sure. But when COVID is severe, there's really two organ systems that we worry about the most. COVID starts to cause damage in the blood vessels and causes a lot of blood clots. It's linked very closely to clotting disorders now, strokes, pulmonary emboli, deep vein thromboses. So that's one organ system that COVID affects. The one that people are hearing the most about, of course, is that when COVID starts to cause damage in the lungs themselves. We don't have good treatments right now for reversing that damage, or good pharmacologic treatments for reversing that damage. Our COVID therapies in the hospital setting are really aimed more at inflammation, at halting the damage, and then supporting your body through its own healing process. And then we have a whole separate category of medications which are out there really remarkably in the last 2 years that are intended to help prevent that damage from happening.
Well, because it overwhelms you. It just overwhelms your immune response. You can't breathe, and you don't have oxygen, and you still have 3 more days before you're going to have an adequate immune response. So then you're done. So really everything is geared towards getting your antibodies up and running in time to fight this. And you know, living a healthy life, exercising, eating right, taking vitamin, all of that is important, suggested, and a good idea. People who do that are looking out for their health, and they're less likely to be smokers, they're less likely to be overeating, they're less likely to not be exercising. So all of that is important, but that's not all of it. Statistically, yes, people who have high blood pressure, diabetes, any kind of lung disease, or are heavy or obese, are much more at risk for having severe COVID. That's clear, but it doesn't mean that other people won't. And we've had children under the age of 3 medevaced from Mercy Hospital to UC Davis for COVID. We've had teenagers with severe COVID. We've had 40-year-olds die with COVID. So to say, well, it's just going to be the old people and the heavy people, that's a little cavalier to say that, because it could be me next week. We really don't know that. And remember that a small, tiny mutation that's made it weaker, next month we could see a different mutation that makes this highly deadly for 5-year-olds to 12-year-olds or teenagers. I mean, that could happen at any time, and hopefully it won't. But all the more reason for us to work together to use these guys and try to suppress the spread of this.